Pandemic has been a real challenge for all of us in a number of different ways, but I'll bring that back down to myeloma. In our earlier surveys, we had lost between 30 to 40% of myeloma patients when they got COVID. And this was quite striking. I mean, there were times, these were real dark times for patients as well as us as treating clinicians. We were really concerned about our patients. So we're now happy that all of our patients have been vaccinated at least 4 times. And I've led a study called the FRCPath study, which shows that antibody responses in our patients, although not at the same level as in healthy volunteers, it is still elicitable in our patients. And all these vaccination boosters have also enabled both T-cell response as well as antibody response in well over 70% of our patients. Now there is access to oral antivirals as well as antibody therapies. Our patients have got a secure setup to access these therapies. But the other things that we have learned during this time for our patients is that when they've been very much stationed at home, they've had less infections and less admissions to hospital. So this is a particular learning that we have had during the pandemic for our patients, and therefore trying to keep them more safer with just behavioral measures is going to be an important part of keeping our patients safe. Because all the new therapies that are coming through in myeloma do increase infection rates, and we need to minimize them by good behavioral measures as well as vaccination. But we hope to get out of these pandemic fairly swiftly, because access to clinical trials has been a challenge during the pandemic, and that really has been something that we have been working hard in the last 6 months, and we want to open that up for our patients in the next 6 months or so.